Next, I would like to invite WA Country Health Service to present their graduate programs, and we would be hearing from Melissa Natoli, Wendy Milne and Claire Summers.
Good afternoon, everyone. My name is Lisa Natoli. I'm one of the nurse managers in Workforce at the Country Health Service. Along with me today is Wendy Milne. She is the Nursing Workforce Manager for Midwifery. She'll be presenting with me, and also Claire Summers on mental health options in WA Country Health Service. So thank you for listening in. So WA Country Health, we're one of the largest public network of public hospital services and nursing posts over a huge vast of regional areas in WA. So we consist of 7 regions. We exist from the up top of the Kimberley right down to the Great Southern and Southwest at the bottom of WA. So in the country, we've obviously got a huge amount of attractions, quite different to the metro, but we've got a very lovely lifestyle. We have a huge community relationship. We have family-friendly towns. We have unique experiences that you can develop a broad skill set development and specialties. We have RFDS and ambulance transfers and emergency telehealth services. We also have specialised nursing and midwifery roles and WA Country Health benefits. So these are just some of the unique opportunities that we can offer you to come and work in the country. Sorry guys, that slide's a little bit blurry. I hope you can see it. There we go. So we do have an array of specialty options, and there's quite a few listed below in the tab. So we've actually got medical, surgical, midwifery, paediatrics, rehabilitation, emergency, ICUs, renal, chemotherapy units, mental health options. So you can see that we do cover a wide range of opportunities in all our regional centres. Okay, so we've got graduate programs in 7 of our amazing regions. Okay, so I'm going to start off with the Kimberley region, and then I will start off about the nursing, and Wendy will jump in about the midwifery options as well. Okay, so the Kimberley region is obviously the state's most northern region, and it's mostly identified by Broome, Derby, Wyndham and Halls Creek. So we have a newly qualified program that offers graduates a 12-month rotational program, and it allows nurses to complete 2 6-month rotations in Broome, Derby, Fitzroy Crossing and Kununurra. We also have specialties on offer which include medical and surgical, perioperative, paediatrics and emergency, and the Kimberley also offers a specialised 12-month mental health and community health programs. Well, I'm not sure why Wendy's not jumping in, so I'll continue on. We also have a newly qualified midwifery program, which offers graduates a 12-month program based at the Regional Hospital in Broome, and it's rotating through all of midwifery care, including the options of rotations to midwifery group practice, which is our MGP models in Kununurra and Derby. So we've got the fantastic Pilbara region, which is go down WA. So it's a fantastic region for nurses and midwives who have an interest in rural and remote health centres. It also specialises in Aboriginal health and working at sites both large and small. The most densely populated areas are Karratha, Headland, Newman and Tom Price. The newly qualified program offers graduates a 12-month rotational program at Headland, Karratha and Newman, allowing graduates to rotate in different areas of the hospital. The Pilbara also offers a 12-month transition programs in specialties such as emergency, cancer, population health, perioperative, aged care, infection prevention and control, community health and community mental health. We also have the newly qualified midwifery program, which offers graduates a 12-month program at either Headland or Karratha, and it rotates through all aspects of midwifery. Okay, so we have the Midwest region. So the Midwest region incorporates the Gascoyne, Geraldton, Midwest and Murchison. So the most densely populated areas will be Geraldton, Dongara, Kalbarri, Morawa, Meekatharra, Carnarvon and Exmouth. And the region also includes the internationally recognised Ningaloo Reef and Shark Bay World Heritage Sites. As you can see, we've got some geographical pictures of our sites, and it's enough to entice you to want to go and explore one of these options, I always think. So the newly qualified program offers graduates positions in a range of areas, including general ward, perioperative, palliative care, post-acute care services, paediatrics, emergency, high dependency units and mental health. So graduates can spend 12 months at Geraldton Health Campus or Carnarvon Hospital, or they can spend 6 months at Geraldton, then 6 months at one of Midwest's more rural and remote centres, including Exmouth, Kalbarri, Meekatharra, Northampton, Morawa, Dongara and North Midlands. So the Midwest also offers 2 specialised 18-month programs specialised in emergency and high dependency unit, and they also offer specialised 12-month perioperative nursing program. The nursing and midwifery program also offers a 12-month program at Geraldton Hospital, rotating through all aspects of midwifery care, and the possibility of a rotation to Carnarvon's MGP model as well. So the Goldfields region, and for those of you that know me, this is my hometown. So we're one of the largest regions, and it's over the It's 3 times the size of Victoria. It's the most densely populated area in the region are Kalgoorlie, Esperance, Leonora and Laverton. So the newly qualified program offers the graduates 12-month program. It helps nurses to develop a wide range of skills in medical and surgical nursing at either Kalgoorlie or Esperance. And there is also potential for rotations in emergency, paediatrics, palliative care and infection prevention and control. The Goldfields also offers specialised graduate programs in perioperative, mental health and community health. And we also offer our newly qualified midwifery program, which is 12 months, which offers all aspects of midwifery care and can also offer a rotation down to Esperance. So as you can see, we've got the largest hole in the ground as well. So the Wheatbelt region is getting a little bit closer to the metro sites. The Wheatbelt contains the highest number of small hospitals in any WACHS regions. So you would have heard of places like Northam, Narrogin, Merredin, Moora, Jurien Bay, Bindoon, York and 2J. The newly qualified program offers graduates a 12-month program in Northam, Narrogin or Merredin. It can include smaller rotations to our smaller sites. So you can read there Beverley, Bonington, Bruce Rock, Corrigin, Dalwallinu, Dumble-Young, Goomalleen, Calaburn. So as you can see, there's quite a few rotations that you can do at not only the bigger sites, but the smaller sites in that area. So graduates will develop a broad range of skills during their graduate program, including managing emergency care and utilising emergency telehealth to communicate with medical staff for both inpatients, outpatients and emergency presentations. So the Southwest region is WACH's most populated region and covers an area of 23,000 or 24,000 kilometres. It's also one of the most visited regions outside of the Perth metro area. So newly qualified. The newly qualified program offers a 12-month program in Bunbury, Busselton, Bridgetown, Collie, Harvey, Nannup, Boyup, Brook, Ryan, Pemberton and Margaret River. So graduate nurses will develop also a broad range of skills in managing general medical, surgical, paediatric and aged care patients and acute emergency skills. They also have specialised programs, 12 months in mental health and community health. And we also have a newly qualified midwifery program, which is 12 months also, Bunbury Hospital, Busselton, MGP in Collie, Bridgetown and Bunbury. So the Great Southern Region is our last region. So we have Katanning, Denmark, Kojonup, Garangarup and Mount Barker. So we have a newly qualified 12-month program also, which offers programs in Albany, Katanning, Kojonup and Garangarup across general medical, surgical, day surgical, subacute surgical, emergency, mental health. And the graduates may rotate between the regional resource centres and the smaller sites. They also offer a specialised 12-month mental health program, and the newly qualified program offers graduates a 12-month program at Albany Hospital, rotating through all aspects of midwifery care. So as you can see, our programs are very diverse and they offer just not one rotation, but you may be offered many rotations throughout that region during your graduate program. So all nurses and midwives in WACHS graduate programs receive support and education to develop skills and promote professional growth. Programs include orientation, study days and support throughout each program, including midwifery Pacific days. So as I've mentioned, they may be rotating through one hospital or across a number of hospitals in the same region. They can include remote areas, include specialty areas, or just be a specialty as itself, as we just identified. And obviously it's by recruitment through Grad Nurse Connect. So I'm just going to see if Wendy can link in and give you the midwifery graduate programs update. Wendy, are you there?
Hi Lisa, it's Claire. Wendy's popped in the chat that she's struggling with some technical issues.
No worries at all. So you're stuck with me. Okay, so midwifery graduate programs. We've got programs suitable for direct entry or dual qualified midwives. So they may be hospital-based midwifery programs, a midwifery group practice, which is what we call the MGP models, rotation to level 2 nurseries, rotation to one of our smaller maternity sites. So midwifery workforce and Shan will offer 3-day midwifery Pacific WACHS orientations. They offer supernumerary days at each rotation. They offer support from our midwives education and central office. And we also have a midwifery and obstetrics emergency telehealth service. So we've just got some links there to show you how we actually apply to our nursing and midwifery careers and our contact email addresses. And we've just got up there some of our newly qualified nurses have actually given testimonials as to why they chose to come and work in WA Country Health Services and what experiences they actually have received while being in WA Country Health Services. And it's nice to know that have feedback from people that are actually in the programs. Great, okay. So we actually have, WA Country Health can actually help pay your HECS debt. So if you require any further information, I've actually got the information up there and the links. Apologies, I don't know why my clicker keeps on advancing ahead. I can actually email you the information about if you come and work in WA Country Health, what incentives we can actually give you to pay off your HECS debt, and there is links available. So please feel free to email either myself or Wendy and we'll be able to provide you further information regarding this. And also the Grad Nurse Connect recruiters at each region will be able to assist you with this information as well. So I'm going to talk about the WA Country Health Transition to Rural Adventure and Lifestyle Travel Program. So we actually offer a program that allows you to travel across, if you wanted to, all the 7 regions. It's a 12-month program that can be extended, and it's tailored to suit your experience and also the sites that you'd actually like to go and work in to seek more clinical experience and more country lifestyle. So we have 3 4-month rotations, and as I said, this can be extended. It's suitable for nurses and midwives. We just have one stipulation that you actually have completed 12 months of your midwifery program. So rotations can include specialty areas such as emergency, theatre, high dependency and midwifery unit. We offer support, education, clinical skills and professional growth. We offer relocation assistance and travel time, and we also provide subsidised, fully furnished accommodation at each site. We have programs that start. The program is extremely popular with nurses who want to actually experience all of what WA has to offer and the clinical and specialty opportunities they get to obtain while they're out there. So there's just a bit more about extension of possibilities. So we do the travel program. We also have a variety of employment opportunities after you've finished your graduate program, and living in the country can expose you to a whole new life of opportunities. So one of our nurses, travel nurses, said, there are less people in this town than I have in Facebook friends, and I love it. Right, so I'm going to hand over to Claire Summers.